So today I'm going to talk about what is diabetes. I know diabetes is the most common issue right now, but people take it really lightly. So what I believe is, even if you have diabetes, you need to take proper precautions. Maybe it can be low, or maybe it can be really high, or it can be normal. But still, you need to take proper precautions, and also you have to keep in control. So that's the first main thing if you're having diabetes. Right. And also, if you want to know how you can inject your insulin, or how you can inject insulin using a syringe, you can check my previous videos where I have clearly showed how you can do that. And even if you want to check your diabetes at home, you can also check that in my previous videos. So that I hope that's useful. So now we will look in what is diabetes, what are the different types of diabetes, how common is diabetes, who is more likely to develop, and also what health problems can people develop with diabetes. Right? So diabetes is a disease that occurs when your blood glucose, also called the blood sugar, is too high. Blood glucose is your main source of energy and comes from the food you eat. Insulin, a hormone made by the pancreas, helps glucose from food get into your cells to be used for energy. Sometimes your body does not make enough or any insulin, or doesn't use insulin over time. Having too much glucose in your blood can cause health problems. Although diabetes has no cure, you can take steps to manage your diabetes and stay healthy. Sometimes people call diabetes a touch of sugar or borderline diabetes. This term suggests that someone doesn't really have diabetes or has less serious case, but every case of diabetes is serious. So that is what I explained you all, that though diabetes can be high or low, you need to manage it if you have diabetes. Different types of diabetes. The most common types of diabetes are type 1, type 2, and gestational diabetes. Type 1 diabetes: if you have type 1 diabetes, your body does not make insulin. Your immune system attacks and destroys the cells in your pancreas that make insulin. Type 1 diabetes is usually diagnosed in children and young adults. Although it can appear at any age, people with type 1 diabetes need to take insulin every day to stay alive. Type 2 diabetes: if you have type 2 diabetes, your body does not make or use insulin well. You can develop type 2 diabetes at any age, even during childhood. However, this type of diabetes occurs most often in middle-aged and older people. Type 2 is the most common types of diabetes. So what are the symptoms of diabetes? Symptoms of diabetes include increased thirst and urination, increased hunger, fatigue, blurred vision, numbness or tingling in the feet or hands, sores that do not heal, unexplained weight loss. So, what causes type 1 diabetes? Type 1 diabetes occurs when your immune system, the body's system of fighting infection, attacks and destroy the insulin producing beta cells of the pancreas. What causes type 2 diabetes? Type 2 diabetes, the most common form of diabetes, is caused by several factors, including lifestyle factors and genes, overweight, obesity, and physical inactivity. You are more likely to develop type 2 diabetes if you are not physically active and overweight or obese. Right? So you need to take care of your weight as well. Extra weight sometimes causes insulin resistance and is common in people with type 2 diabetes. The location of the body fat also makes a difference. Extra belly fat is linked to insulin resistance, type 2 diabetes, and heart and blood vessel disease. So, what is gestational diabetes? Gestational diabetes develops in some women when they are pregnant. So, pregnant mothers, be careful. Most of the time, this type of diabetes goes away after the baby is born. However, if you had gestational diabetes, you have a greater chance of developing type 2 diabetes later in life. Sometimes, diabetes diagnosed during pregnancy is actually type 2 diabetes. So, who is more likely to develop type 2 diabetes? You are most likely to develop type 2 diabetes if you are aged 45 or older, have a family history of diabetes, or overweight, physical inactivity, race, and certain health problems such as high blood pressure also affects your chance of developing type 2 diabetes. You are also more likely to develop type 2 diabetes if you have pre-diabetes or had gestational diabetes when you were pregnant, right? So you have to know more about the risk factors for type 2 diabetes. So, what are the other health problems that can occur with diabetes over time? High blood glucose leads to problems such as heart disease, stroke, kidney disease, eye problems, dental problems, nerve damage, food problems, right? So, these are the most scariest thing, which can also maybe end up in death. So, people who have diabetes, you have to really take care of yourself. And I have seen so many cases of these food problems where they just cut off your leg, right? Which is really bad. So, you'll have to take care of your diabetes and also manage a proper level with your diet and also other things. Resistance. Type 2 diabetes usually begins with insulin resistance, a condition in which the muscle, liver, and fat cells do not use well. As a result, your body needs more insulin to help glucose enter the cells. At first, the pancreas makes more insulin to keep up the added demand. Over time, the pancreas can't make enough insulin and blood glucose levels increases. Genes and family history. As in type 1 diabetes, certain genes may make you more likely to develop type 2 diabetes. How can you lower your chances of developing type 2 diabetes? There are some things you can change to lower your risk. Choose a weight which is a certain weight which doesn't cause diabetes, which means lose your weight, right, and keep it off. Move more, which means you have to walk more, or you can do any movements. You can also exercise. Eat healthy foods most of the time. What should you do if your healthcare professional told that you have pre-diabetes? Pre-diabetes is when your blood glucose, right, also called the blood sugar levels, are higher than normal, but not high enough to be called diabetes. Having pre-diabetes is serious because it can raise the chance of developing type 2 diabetes. Many of the factors that rise your chance of developing type 2 diabetes put you risk for pre-diabetes. Gestational diabetes when you are pregnant. How can you lower the chances of developing type 2 diabetes? Gestational diabetes is a type of diabetes that develops during pregnancy. Most of the time, gestational diabetes goes after your baby is born. Even if your gestational diabetes goes away, you still have a greater chance of developing type 2 diabetes within 5 to 10 years. Your child may also be more likely to become obese and develop type 2 diabetes later in life. Making healthy choices helps the whole family and may protect your child from becoming obese or developing diabetes. So, what are the steps you should take in count in order to take care of yourself and your child if you had gestational diabetes? Get tested for diabetes 6 to 12 weeks after your baby is born. If your blood glucose is still high, you may have type 2 diabetes. If your blood glucose is normal, you should get tested every 3 years to see if you have developed type 2 diabetes. You should be more active and make healthy food choices to get back to a healthy weight. Breastfeed your baby. Breastfeeding gives your baby the right balance of nutrition and help you burn calories. Ask your doctor if you should take the diabetes drug metformin to help prevent type 2 diabetes. Who should be tested for diabetes? So, who should be tested for diabetes is anyone who has symptoms of diabetes should be tested for the disease. You can check in my feed as well. What are the symptoms? Some people I will not have any symptoms but may have risk for diabetes and need to be tested. Testing allows healthcare professionals to find diabetes sooner and work with their patients to manage and prevent complications. What are the recommended targets for blood glucose levels? Many people with diabetes aim to keep their blood glucose at the normal levels before a meal, 80 to 130 milligram. About 2 hours after a meal starts, less than 180. Talk with your healthcare team about the best target range for you. Be sure to tell your healthcare professional if your glucose levels often go above or below your target range. What happens if your blood glucose becomes too low? Sometimes blood glucose levels drop below where they should be, which is called hypoglycemia. For most people with diabetes, the blood glucose level is too low when it is 70 milligram. Hypoglycemia can be life-threatening and needs to be treated right away. Right, and also you need to learn about how to recognize and treat hypoglycemia because though it says it's low diabetes, it is also an issue like high glucose levels because when you have a low glucose level you might even faint and which is you can also feel really dizzy or maybe you can't walk properly. All that is there. So therefore, even if you have low diabetes, please do check it and also take right precautions before it gets worse. What happens if your blood glucose levels becomes too high? Okay, so doctors call high blood glucose hyperglycemia. Symptoms that your blood glucose level may be too high include feeling thirsty, feeling tired or weak, headaches, urinating often, and a blurred vision. So I hope the video was useful, guys. If you all found it useful, do not forget to like, share, subscribe, and also comment below if you all know any other symptoms or if you all know any other way where you could lower your glucose levels. Maybe it can be any home remedies or maybe any other thing. So you can also comment that below. And if you're new to this channel, please don't forget to like, share, and subscribe my YouTube channel. And if you want to know how you can inject an insulin using a syringe, using an insulin, and also to check your glucose levels at home, you all can check my previous videos and don't forget to show some love. Thank you.